ALPINE study was a phase 3 head-to-head randomized trial comparing zanubrutinib to ibrutinib. Ibrutinib has been a major game changer in treatment of chronic lymphocytic leukemia with high effectiveness, but because of adverse events, some of the patients were not able to continue therapy. Zanubrutinib is a next generation BTK inhibitor. It's more specific to BTK without much off-target effects. Therefore, less side effects are expected. And in fact, in clinical studies before this study, we observed fewer rates of or lower rates of adverse events with zanubrutinib. Also, because of the characteristics and pharmacologic characteristics of the drug, it was expected that efficacy could be higher. The exposure, the BTK occupancy, and other characteristics of the drug would basically bring the hypothesis of maybe even more efficacy with zanubrutinib. So the study was designed with the primary endpoint of non-inferiority and superiority of overall response in zanubrutinib compared to ibrutinib in patients with previously treated CLL, and also had secondary endpoints of adverse events, mainly cardiac adverse events, and also progression-free survival. With the interim presentation of this study, we know that zanubrutinib had a superior overall response compared to ibrutinib. That's a combination of complete response and partial responses. For this presentation, we reported on the final analysis showing progression-free survival comparison between zanubrutinib and ibrutinib, and this was the key point of the presentation. But I should also mention that we continue to see a better and improved overall response of 86.2% with zanubrutinib compared to 75.7% with ibrutinib. So that's continued to be seen and observed. In terms of the progression-free survival, which was the main point of this presentation, patients treated with zanubrutinib had at 24 months and with a median follow-up of more than 29 months, had 79.5% progression-free survival, and that's compared to 67.3%. This is all comers, and the difference is statistically significant. Also, focusing on a planned analysis on patients with del17P and P53 mutation, which is, of course, an important subgroup of patients with CLL, zanubrutinib provided a 2-year PFS of 77.6% compared to 55.7% with ibrutinib, and of course this was statistically significant. So the efficacy for the first time in CLL, a drug showed an improved efficacy compared to ibrutinib, and that's why this study gained a lot of attention, and it is important for clinical practice, as we will discuss. We also noted that fewer patients on zanubrutinib arm had discontinuation of therapy because of side effects, 15.4% compared to 22.2% in the ibrutinib arm. And then focusing on cardiac side effects and the cardiac profile of the two drugs, basically atrial fibrillation with zanubrutinib was zero. I'm sorry, the adverse events that led to the discontinuation, no patients on the zanubrutinib arm discontinued drug because of AFib, and 5 patients or 1.5% discontinued drug on the ibrutinib arm. And in terms of cardiac events, that the fatal cardiac events leading to death, no patients on the zanubrutinib arm and 6 patients in the ibrutinib arm, and that's 1.9%. Overall, the rate of atrial fibrillation and A-flutter was also significantly lower in the zanubrutinib arm versus ibrutinib arm with 5.2% versus 13.3%. So overall, the study, the take-home points are that zanubrutinib continues to be effective and showing improved efficacy. As I said, this is the first time a head-to-head study showing that, both from the overall response standpoint and also progression-free survival over ibrutinib, and also showing fewer side effects and significantly lower rates of atrial fibrillation and A-flutter. There are some other adverse events in which we did not observe a difference, and one would be hypertension. That's another adverse event of interest with BTK inhibitors, and this study did not show any significant difference between the hypertension rate in zanubrutinib versus ibrutinib. I think these are important results and practice changing. Before this presentation, we knew that zanubrutinib had a better safety profile, but now with efficacy signal, I think this is an important message and important point of discussion when we sit with patients and discuss treatments. I think zanubrutinib is definitely superior to ibrutinib in terms of treatment of choice, and I think this study is practice changing in that regard. In terms of the future of this study, the study will continue to we will follow up these patients, and like any other randomized trial, long-term follow-up will be important, both for efficacy and also some of the side effects and adverse events may increase over time or may decrease over time, and the differences may change. So the study will continue, and we will hopefully have long-term follow-ups. In terms of future of the drug in CLL, as we all know and saw at the ASH meeting, there's a lot of activity and interest in combination studies using BCL2 inhibitors and BTK inhibitors, for example, in combination plus minus anti-CD20 antibody. So this drug will be a major player in the combination regimens, and we will see more of studies coming out with zanubrutinib combined with different type of BCL2 inhibitors. So really looking forward to having that data in upcoming meetings.